for giving me this opportunity to talk about a very important and innovative aspect of medical curriculum. Entrustable Professional Activities, or EPAs, the way forward. Okay, can anybody in the audience guess who this person is? A famous doctor from a popular series. कोई तो होगा जो बताए. Dr. House. So, can you trust this doctor for your treatment? This we are going to answer today, right? Okay. What is the ultimate goal of medical training? The ultimate goal of training is to produce doctors whom we can trust to provide safe and quality care with little or no supervision at all. By the end of this session, we will know why EPAs, what are EPAs, how to develop and implement them, and what are the benefits and challenges of their implementation. So, why EPAs? कौन सा फोन चाहिए? Obviously बड़ा stupid सा question है. iPhone. ये कौन सा iPhone है? कौन सा है? 14 है ये. इसके कैमरा से आइडेंटिफाई करेंगे. देखिए. Okay. Which one of the cars do you want? दोनों ही नहीं है. एक हाइड्रोजन है, एक इलेक्ट्रिक है. So it is in the human nature to evolve for new things. नई चीज की तरफ जाना चाहते हैं. What is the best model of medical curriculum? हर चीज best चाहिए ना. तो best model of medical curriculum क्या है? Is it the integrated curriculum? बहुत आजकल famous चल रहा है integrated curriculum. क्या वो सबसे best है? It is an empty box. We are not sure. Or maybe it is outside the box and we are not aware of it. So let's take a brief review about the history of medical curriculum evolution. It starts with the apprenticeship model. Apprenticeship model has a long and rich history dating back to the ancient times. In the ancient times, the medical students would work under supervision of experienced physicians and learn clinical skills by observation and participation in the patient care. There was no medical school, no basic science curriculum. Chief learning strategies were memorization and repetition, and the main educational format was note-taking. Then, in the 19th century, there was a significant transformation in medical curriculum in USA and Europe with the establishment of medical schools and adoption of a more formalized curriculum. In early 20th century, Flexner reports in the USA led to the adoption of a structured and organized form of the curriculum in which there were basic sciences in the first 2 years and clinical training in the next 2 to 3 years, and this is being adopted in majority of the medical colleges in Pakistan. अभी तक ही चल रहा है. So इसके बाद आया integrated curriculum, system based curriculum. Can you make something out of these pictures? कोई सेंस बनती है? चलें, चल गया. ओके, अब कोई सेंस बनती है? So this holistic and integrated approach is the basic concept of integrated curriculum. Integrated curriculum is basically based on interdisciplinary collaboration, problem-based learning, and incorporation of social determinants of health like professionalism, ethics, research, and law. इस लेवल पे हम अभी struggle कर रहे हैं. The West has moved on to competency-based curriculum. It is a student-centered curriculum which is cost-effective, improves compliance, and it focuses on specific competencies and critical thinking that are essential for medical practice. It requires outcome-based education and workplace-based assessment and uses tools such as EPAs to assess and train the students. Now that we know that what is its significance, so let's see what are actually EPAs. Entrustable professional activities are units of professional tasks or activities that can be entrusted to the learners to perform independently in a given context after they have demonstrated the desired knowledge, skills, and attitudes required for that task. So basically, it starts with the end in mind. What do you expect a finishing learner or a student to be able to do independently? Let's understand this with an example. She's your resident and she calls you in the evening that there is a call from surgical emergency department. They want you to come and evaluate patient of suspected ectopic pregnancy. आप क्या कहेंगे? Okay, go see the patient, keep the theatre prepared, or inform करते रहें. So would you trust this learner to perform this task without supervision? The answer is EPA. So EPAs are different from the traditional curriculum by the fact that they are based on professional tasks. There are specific measurable and observable competencies integrated in the task. Level of entrustment is required. Time frame is variable. There is workplace based assessment, and all this leads to the improved patient care. The Dutch Medical Act says that licensed physicians are entitled to perform medical tasks provided that they are competent. But what is competency and how do we know that a doctor is competent? Competency is the ability of a person to do something related to knowledge, skills, and attitudes. So these competencies are basically the person descriptors. EPAs are work descriptors or designated tasks, and each task is an integration of the multiple competencies. Look at the Miller's prism of clinical competence. The basis is factual knowledge, knows. Then there is application of knowledge, knows how. And then the demonstration of competence shows. हमारे students और हमारे learners अभी तक इस level पे हैं. We are assessing and training our students at this level. But what is actually desired is workplace-based assessment and training. This is the DOES level, and this is what EPAs will do. So how to develop and implement them? The first step is to identify a task. हमने कहा था कि EPAs are based on professional tasks. So task identify करना है. For example, history taking an examination is a task. 13 core EPAs ये एग्जाम्पल के तौर पे स्लाइड लगाई है. अमेरिकन एसोसिएशन ऑफ मेडिकल कॉलेजेस ने 13 core EPAs बनाए हैं फॉर स्टूडेंट्स बिफोर एंटरिंग द रेजिडेंसी प्रोग्राम. उन्होंने ये क्लियर करने हैं तो वो रेजिडेंसी में एंटर करेंगे. सो आप देख सकते हैं, gather history, perform examination, provide differential diagnosis, recommend and interpret common diagnostic and screening tests, and so on. अब next step क्या है? Once you have identified the task, then identify the competencies which are required for the task. And these competencies would be divided into knowledge, skills, and attitudes. Example, हमने professional task देखा था, history taking an examination, उसकी various competencies ये हैं. And these are knowledge, skills, and attitude based. Like art, good doctoring requires integration of all elements and competencies. ये examples है कुछ EPAs की जिसमें competencies को integrate किया हुआ है. ये देखें competencies इसमें ये इसमें ये सारी integration of competencies. Another example of the EPAs and in this ये competency domains जो है ना इनको integrate किया हुआ है. The important thing is that the task and the competencies should be aligned. They should fit with each other. Third step, determine the level of entrustment. अभी तक हम ट्रस्ट की बात करते हैं तो हम देखना चाहते हैं ट्रस्ट अपने स्टूडेंट्स में, अपने रेजिडेंट्स में. जब हम ट्रस्ट की बात करते हैं तो क्या देखना चाहते हैं? We want to see their integrity, their reliability, predictable behavior, and their humility. लेकिन I want to ask the supervisors whether we really do teach and assess trust in the form of hidden curriculum. शायद हाँ इसको आता है चलो इसको भेज दो सर्जरी के लिए, इसको नहीं आता नहीं इसको नहीं भेज. लेकिन we are not explicitly teaching and assessing trust. So talk explicitly about trust and this would be done in the EPAs. EPAs में आप entrustment levels देंगे. For example, number one, observation. Number two, direct supervision. Indirect supervision. Number four is independent practice. And this is teaching others. So basically, the independent practice is required. Level 4 या level 5 होना चाहिए. This is an example of a portfolio of a person who has completed various levels of the entrustments of various EPAs in the 4 years residency program. आप देख सकते हैं कि कुछ में वो सेकेंड ईयर में ही लेवल 4 में पहुंच गया. So this is different from our current system. हमारे current system में क्या है? Fixed time period 3 years, 4 years. And then what happens? Some may pass, some may fail. Variable outcome. लेकिन EPAs में there is a variable time frame. ये कॉम्पिटेंसी है उस स्टूडेंट की, उस रेजिडेंट की, वो बेशक सेकेंड ईयर में कंप्लीट कर ले सारे EPAs. उसकी कैपेबिलिटी, उसकी एंथुसियाज्म, राइट? सो देयर इज अ फिक्स्ड आउटकम एंड देयर इज वेरिएबल टाइम फ्रेम. बोर्ड तो नहीं होगा. चलें, ये स्लाइड इसीलिए लगाई. अभी तक हमने बात की प्रोफेशनल टास्क की, कॉम्पिटेंसीज की, एंट्रस्टमेंट लेवल्स. द फोर्थ स्टेप इज असेसमेंट टूल्स. इसकी असेसमेंट कैसी होती है? There are multiple formative assessments with feedback and summative assessment just like getting a license for car driving. तो उसमें आपको वर्क प्लेस बेस्ड असेसमेंट होती है एंड मल्टीपल एग्जामिनर्स होते हैं, मल्टीपल टाइम्स असेसमेंट होती है. एंट्रस्टमेंट डिसीजन इसमें पास और फेल नहीं होता. इसमें क्या होता है? इसमें एंट्रस्टमेंट लेवल देना होता है. Normally the psychology of traditional workplace traditional assessment हमारी क्या साइकोलॉजी होती है? अच्छा, 2 दफा चलो बेचारी फेल हो गई, अब पास करी 2, वरना तो बेचारी का मोरल बहुत नीचे चला जाएगा. वो मेहनत तो करती है ना, चलो पास कर. ये नॉर्मली हमारी साइकोलॉजी होगी. बट व्हाट वुड हैपन इन EPAs? EPAs में आप ये सोचेंगे कि शी इज नाइस एंड वर्क्स हार्ड, बट कैन आई ट्रस्ट हर विद दिस EPA? It may hurt my patient if I mark her ready for unsupervised practice. तो आप उसको एक्चुअल उसका लेवल देते हैं. फॉर एग्जाम्पल, अगर वो ऑब्जर्वेशन के लेवल पे है तो ऑब्जर्वेशन दे देंगे. अगर वो अनसुपरवाइज्ड प्रैक्टिस नहीं कर सकती तो आप उसको लेवल 3 दे दें, राइट? सो असेसमेंट ऑफ EPAs is basically workplace based, multiple tools, multiple times with use of the technology. अभी हम जो असेसमेंट कर रहे हैं वो ये लेवल है एग्जामिनेशन सेटिंग्स में. यहाँ पे सर्टिफिकेट दे देते हैं, दैट इज द एंड ऑफ द ट्रेनिंग. एक्चुअली व्हाट इज रिक्वायर्ड इज वर्क प्लेस बेस्ड असेसमेंट. को एक्चुअली वर्क प्लेस में क्या करते हैं, यहाँ सर्टिफिकेट मिलना चाहिए और यहाँ एंड ऑफ ट्रेनिंग होनी चाहिए. सो दिस इज EPAs. दिस इज द डिस्क्रिप्शन ऑफ एन EPA. ये कुछ एग्जांपल्स हैं कैसे आपने बनाना है, और एंड पे आपने उसकी पायलट टेस्टिंग, इम्प्लीमेंटेशन और उसकी इवैल्यूएशन करनी. सो बेनिफिट्स हम काफी डिस्कस कर चुके हैं पहले भी. इट प्रोवाइड्स अ क्लियर फ्रेमवर्क ऑफ व्हाट इज एक्सपेक्टेड एज अ प्रोफेशनल टास्क, encourages the trainees to focus on competencies. There is a variable time frame. It supports for independent practice and feedback, and it is based on workplace based assessment. तो ये सारा कुछ पेशेंट केयर को इम्प्रूव करते हैं. चैलेंजेस क्या हैं? Resources, time, expertise, financial support. Which tasks are required can be very challenging. Resistance, जाहिर है resistance आएगी कहीं ना कहीं से प्रॉब्लम. Evaluation, workplace based time consuming होती है, and there may be over reliance on the EPAs और बाकी चीजों को आप कंसिडर ना करें. Overall benefits outweigh the challenges. So come out of your comfort zones, face the challenges, and try to reach the success. So thank you very much.